Have you ever heard people talking about that someone is a carrier, so they cannot transmit HIV and they cannot transmit, neither they cannot get HIV and AIDS? Have you ever heard people talking about things like, so and so is HIV positive but cannot transmit HIV, that this person is a carrier? Yeah, I have some of the questions that I'm going to put here or to read them so that we can get to discuss this thing you call carrier. Is it possible that someone can be HIV positive but cannot transmit HIV, and also this person cannot get HIV cannot get the virus? And also, okay, I want to say something. Okay, when long time, when I started hearing people talking about HIV and AIDS, people would say that so and so is HIV carrier. HIV, that they have HIV that is dormant in their body and they cannot transmit HIV and AIDS. And with the time, I came to realize that after doing a lot of research and reading a lot of articles and from nursing school, nothing is called carrier, nothing like carrier. Yeah, so we are going to know about that in this video, so stay tuned, watch this video up to the end. And yeah, so these are the things that people usually ask about carrier. What is this carrier about? Yeah, let me read them. Somebody asked, do HIV carrier test negative? Yeah, that was the first question. Do HIV carrier test negative? And that was the first question. The second question, there is, let me read them and then answer them in this video so that I don't get confused. So there is no such thing like HIV carrier. Yeah, there is nothing like HIV carrier. Is either you are HIV positive or you are HIV negative. You know, there are if you are watching this video, you already know ways of transmitting HIV and AIDS. You can get HIV and AIDS through anal and vaginal when you have sex with someone who is HIV positive. And yeah, you can have HIV AIDS through deep kissing, not just kissing, through deep kissing, and someone has a laceration or a wound in their teeth, in their gum, or not on their mouth. Yeah, so you are capable of getting HIV and AIDS through breastfeeding, through mother to child transmission during birth, through what? Through getting contact with blood which is HIV positive, and you have a wound maybe on your skin, yeah, or on your hands, or where you get into contact with that blood. Also through blood transfusion if it was not well screened. And also, what if you get pricked with a needle which someone who is HIV positive head contact with it? Those are some of the ways that someone can get contact HIV. You cannot get HIV through hugging, through just kissing, through eating with someone who is HIV positive. Yeah, so listen to this question. I have tested negative for HIV out of 6 months, and I believe I am negative by the recommendation of the site and my own doctor. Yesterday I had a discussion with someone, co-worker, that really freaked me out. I consider myself pretty educated of HIV, but they sounded so convinced in their argument that I had to double check it with you. So they stated some people can test negative for HIV but have it dormant in their system and become carrier of the disease. Is this accurate? from everything that I have read, you have to be HIV positive for you to transmit HIV. There is nothing like HIV dormant. Yeah, there is nothing like HIV dormant beyond 6 months. So if you still have that thing, that you have HIV and it is dormant in your body and you cannot transmit HIV, you are wrong. You have to be HIV positive for you to transmit HIV virus. So nothing like carrier, nothing like dormant. Is either you are HIV positive or you are HIV negative. If you are positive, you are capable of transmitting HIV in AIDS if you're not taking antiviral drugs. Yeah, if you're HIV positive, you can transmit the disease if you're not taking antiviral drug. But if you're taking antiviral drug, yeah, you are not capable of, if you are taking them well and you have checked with your doctor and the viral load is 0, yeah, or below 200 and I think something, I just think, I'm not sure, but if your viral load is 0, you cannot transmit the disease. It means that the virus is just inside your body and it is dormant. It is dormant in that they cannot be transmitted, yeah? But not that you don't have the virus. You have the virus in your body. But because you are taking drugs well, or because you are taking drugs the way you have been instructed, it means your viral load has gone to 0 and therefore you cannot transmit HIV. But you are HIV positive. You get it right. So there is nothing like HIV dormant. There is nothing like HIV carrier that I cannot transmit HIV. Either you are HIV positive or you are HIV negative. Nothing like carrier. That is what I'm trying to insist, because there are so many people who still consider themselves that I'm HIV carrier. I cannot get HIV. I will just sleep with someone who is HIV positive and I will not get the disease. You will get the disease if that person is HIV positive and they are not taking that drug. You will contact the disease. So take care. Nothing like carrier, nothing like. And also there is something that people usually say, if you are blood group O negative, you cannot contact any disease. That is wrong. That is wrong, dear. You will get the disease. You will get the disease. You know all the ways of HIV transmission. So there is no where which is written that if you are blood group negative, you will not contact HIV. You will contact it. If you think that you are blood group O negative, you cannot get HIV, you will get that disease. So take care, take precaution where you are supposed to take. Be careful. HIV is real and you can get it even without knowing. You can get it innocently. Yeah, you can get it innocently. We are not safe. So long as you are engaging in sex, you are not safe. Yeah, you are not safe. Bye, till next time. Let's talk about retro. Let's talk about antiviral therapy in the next video. So stay tuned and watch the next video.